So we've got Dr. Jaimie Wilkie is a neuroscientist, an aged care researcher for the University of Auckland, and a health coach in a general practice. She's also a practitioner of the Ronnie Gardner Cognitive Exercise. And Aziza Shawudun, who's co-presenting, and we can see her on the screen now, currently is Year 3 Pharmacy and a recipient of the Hope Foundation Summer Studentship. So welcome to you too.
Thank you so much, everyone. Thank you for having us. Kia ora koutou, ko Jaimie toku ingoa. I'm part of the research team with Joe and Wilkie and Aziza at the University of Auckland for the interRAI Clinical Working Group. And I will be co-presenting with Aziza, who you just met, our Hope Foundation Summer Scholar. I'll be giving a brief intro to our presentation on the Phase 1 survey of interRAI assessment quality reporting. interRAI assessment reports quality improvement, and then Aziza would take you through the methods and the results so far. Next slide, please. So as we all know, long-term care facility assessments are mandated for all people in aged residential care in New Zealand, and well over 1.2 million assessments have been completed, revealing a huge amount of data. However, there is little research describing the utility of the data at person, facility, and organisational level in New Zealand. From our international research and anecdotally, clinicians report difficulty in accessing and interpreting interRAI assessment reports, which are presented in raw formats, and there is minimal use of interRAI assessments to identify care needs and inform clinical practice. We've heard that the sheer volume of data can be overwhelming. There is a perception of low interoperability with other software and systems. Some clinicians feel the data is cumbersome, time-consuming to navigate and interpret, or they do not have the level of expertise to fully interpret or utilize the information. Some are unaware of all the intention or use of data outputs, and others found organizational and technical barriers. Next slide, please. Thank you. To address these difficulties, a working group was formed in 2024, especially to increase the utility of interRAI data. The group consists of almost 50 aged care sector specialists, clinicians, geriatricians, facility managers, quality commissioners, academics, researchers, interRAI, and Māori health experts. Ideas and solutions for how this data can be utilised better is co-created by everyone involved in the assessments, including the individual assessed and their family and whānau. The working group discussed barriers and challenges to the assessment reports and identified 3 main focus areas to improve, which formed the basis for designing this quality improvement survey. The organisational quality improvement is about the systematic use of methods and tools to improve care and outcomes for patients, or quality of care, comparisons of facilities and benchmarking across regions, or DHBs. Individual patient reports is ease of accessing data summaries in a clear and easy to understand format, ability to understand the most important indicators for patient improvement. Data security, AI, and data sovereignty is about ensuring data is protected, stored, and used appropriately. The use of AI to summarize the data outputs and the potential issues that we may have around this. So that was the beginning, and now I will pass you over to Aziza, who will talk about the methods and the interim results.
Kia ora everyone, I'm Aziza. So the objective of this study is to understand clinicians, whānau, older people, and aged care service providers' current interRAI data access, use, and aspirations for future use. Next slide, please. This study involved 2 surveys, one for clinicians and the other for older people, whānau, and caregivers. We explored current interRAI data access, usage, barriers, overall preferences and thoughts, and implications of AI. I'll be presenting the methods and the interim results from the sector survey based on 62 respondents as of January 28th. Next slide, thank you. 50% of our respondents being nurses or geriatricians, with over half having been in their roles for more than 5 years. The majority were female with an average age of 48.5 years and 50% identifying as European. Geographically, nearly half were based in Auckland and half worked in secondary care settings. When it came to interRAI use, 65% of respondents have used it, though 1/3 use it infrequently. Most use it for individual assessment and care planning, and those who do not access interRAI cite reasons such as perceived lack of usefulness, difficulty navigating the system, and time constraints. Next slide, thank you. Over half of respondents feel confident using interRAI assessment results in decision-making, particularly for long-term care needs. However, few respondents note that it isn't responsive enough for daily care planning or incident response. Next slide, thank you. Most respondents understand assessment results, particularly summaries for care planning. However, familiarity with scoring tools is split, that integrating them into care planning is still a challenge, especially when compounded with other barriers such as time constraints and data overload. Next slide, thank you. While most respondents find interRAI easy to access, preferences are clear. Plain language summaries, quick comparison formats such as color coding is highly valued, and there's also a strong need for better integration with existing current care planning software. Next slide, thank you. Almost half were unsure about interRAI's usefulness at an organizational level, which is likely influenced by the large proportion of secondary care participants. And those that are familiar suggested improvements such as CAPS and scale summaries for clinical governance, benchmarking tools, and case mix adjustments to support equitable care. Next slide, please. A significant gap exists in training and support, with the majority felt that they lacked adequate training and resources to use interRAI effectively, and many clinicians have not actually had formal training. In fact, only 20% reported having a dedicated interRAI support system. Next slide, thank you. Just over half of respondents have not used AI tools in practice, and there is widespread uncertainty about AI-generated summaries, specifically about bias, confidentiality, and lack of clinical judgment. Despite this, there is general curiosity in its potential, especially to reduce administrative burden and improve data interpretation, just overall relieving time constraints, provided that there is real-world validation and comprehensive training available. Thank you. I'll pass it back to Jaimie now.
Thank you so much, Aziza. So we really do appreciate all the hard work that has gone into interRAI and all the team behind the scenes. It's so useful and so comprehensive, but there are areas that need improving to make it more user-friendly. So the next stage of our research, the phase 2, is to develop new draft reports from these results, and by holding interviews and focus groups to gain feedback with people working in the sector and in collaboration with the working group and computer scientists, just to develop new reports. We then want to pilot them in aged care facilities and home care settings. And one particular draft report will be an AI method to generate a clinical summary of an individual's interRAI assessment, especially for clinicians. We would then like to develop similar reports for the individual being assessed, and we are looking for funding for that. So next slide, please. If you are interested in participating, we have a link to the participant information sheet here and the QR codes, one for the health professionals and one for the person being assessed. Next slide, please. And we'd like to acknowledge the University of Auckland for the Transdisciplinary Ideation Fund. We'd like to thank the Hope Foundation for Aziza, who's been amazing, the Health Research Council Māori Postdoctoral Fellowship, and also the Joyce Cook Chair in Aging Well. Next slide, please. And that's our references. So thank you so much for listening. And we would like to have any feedback or try and answer any questions that you have.
Okay, so questions from the room? Sally, would you like to?
Repeat it for
I'll
us.
repeat it.
Yes. There is a client summary available on the software. Are you looking to develop something different to that, Jaimie?
What we've just found is that people haven't found it. They don't know where to find it. I'm not an expert in interRAI, I have to say. You probably know way more about this. So to be honest, I don't really know what the client summary is. I'm just going on data that I've pulled out from the research and from what the clinical working group have told us.
So thank you for that. Shelley's going to speak. Got a question? An online question?
So online, Carolyn has asked, is the interoperability issues related to the New Zealand platform, or is this an issue within other countries?
So what I read was it was across countries and New Zealand. I know that there is operability with SOAP and some other user softwares in New Zealand, potentially worldwide, but I think it was both.
Thank you for that. Just one other question. Sorry, Jaimie. The QR codes that you shared on screen, will you be sharing your PowerPoint so that people can get access to those QR codes?
Yeah, absolutely. We would love to have as many people responding as possible.
Lovely. Thank you for that.
Maybe we could just switch the slides back to the QR codes just for the audience. Yeah. I just wanted to add, sorry, around the interoperability. I think a lot of the respondents talked about how there's a lot of redundancy, having to like do the same thing twice, and that was a major issue. In addition to the interoperability, I think it kind of came hand in hand, it seemed, both in New Zealand as well as in many countries wherever interRAI was implemented at this point.
Pauline has a question.
Can you just tell me around AI, if you're looking at using AI to help with some clinical reporting, what kind of information do you put into the AI? Do you put the whole form into AI? How do you, and then ask a question to develop? I'm a bit naive around AI, but can you just explain that process a bit more for me?
Yep. Don't worry, so are we. So we're literally starting at the very beginning. And we're working with Te Whatu Ora and the NAIEG National AI Algorithm Group. And what they have suggested for us to do is we start with a completely fresh AI platform called Azure, because if we were to use ChatGPT or other types, then there'll be all the information coming in from the whole university. But with Azure, it's a completely sort of blank slate that you start with, and then we start feeding the interRAI data into this blank slate, so it's not biased by anything outside of interRAI input. That's about as far as we've got so far on our interRAI knowledge, but we will be working closely with the computer scientists in the university as well as Te Whatu Ora and the Algorithm Council. So watch this space basically, and if anybody else wants to be involved in that, just let me know and we can all work together because it's just so new.
Thank you, Jaimie.
Sally, you have a question?
Hi, Jaimie. I'm on the working group, as is Alex Collis at the back of the room. I'm wondering if it might be useful to the working group to have a presentation from Alex sometime on interoperability. She's been telling me briefly at lunchtime that interRAI data is going into care planning software for some residential care facilities. Is that right, Alex? Yeah, so would that be useful so everybody's on the same page around interoperability and what's happening already?
Yeah, definitely. Thank you, Alex. I know you came up with some good comments in our presentation the other day to the working group, and we really appreciate that, and we would love to understand more.
I might add to that suggestion while you've got Alex. It might be a good idea to get Alex to show you the suite of reports that are currently available from the software, because part of it, there's two parts, isn't there? There's the content and then there's the availability or how it's presented. And if you knew that the content was good but people couldn't access it, or maybe that people could access it and they didn't like the content, but at least you know what's already in the national system. Because I know there's a lot of reports out there that aren't used because people don't know they're there to be used, but it could be because they weren't very helpful, or who knows.
Yeah, a presentation, as Simone said. Any other questions there? Well, I want to be a big show off and tell you that I've done the whānau survey.
Woo.
I know you've got at least one respondent, because it just so happened it was associated with a family member. So I would say, if that's all the questions, thank you very much for your interesting presentation. And are we asking them to come back next year as well? I think so. We need to hear more. Okay, thank you very much.